Hey guys, welcome to episode 138. Joining me today, a doctor who treated patients for Ebola in West Africa and contracted Ebola himself, Dr. Craig Spencer will join me. Then a woman who's dedicated her entire career to fighting poverty from the Center for American Progress, Rebecca Vallas, and everybody's favorite constitutional law scholar, Professor Eric Segall, on the latest developments at the Supreme Court. And do your kids call you on FaceTime from the other room, ask you a mundane question, and then hang up without saying goodbye, or is it just my Julia? I'm Pete Dominic. Stand up with me right now. Well, I don't condone the use of the C word to call women, but I do make an exception if you are Europeans and you're using the C word to refer to men. I, for some reason, think it's funny. That is audio from apparently England just after the inauguration. I hadn't heard it till yesterday, and I listened to it like 50 times and loved it, so I thought I would open with it today. Hey, everybody, I hope that you're having a good week. Thank you very much for joining me today. Today's really a special show, I think, because two of my three guests are just absolute heroes who have dedicated their lives and their careers to saving lives and fighting poverty. First, I'll talk to Dr. Craig Spencer, who comes highly recommended from my friend and subscriber, Dan McDonald. And then I will talk to my old friend, Rebecca Vallas, who has been spent her whole career fighting poverty and now works at the Center for American Progress. She hosts a podcast. It's really good about anti-poverty measures and policies and stories called Off Kilter with Rebecca Vallas. And then I, of course, always great to talk to Eric Segall. Everybody knows how much we love him. And we've had two major days of Supreme Court decisions coming down because, after all, it is June. And I harangued him into joining me live yesterday on Twitter. We did the interview to talk about the most recent case that has to do with destroying the Establishment Clause of the First Amendment and the separation of church and state and allowing religious schools to get public funding. It's a real bad one, a real disaster. We'll talk about all of that. But these conversations today are just great. And I'm excited, really excited to share them with you. Okay, so also I want to thank new subscribers. First, I want to welcome Leah Schramm to the community. She signed up this morning with a $5 paid subscription. And then I got at 9:30 Herb Klinker, whose name and life I know a bit about because he's been a long-time listener of the show, and we've exchanged emails many, many times. Great guy. Love Herb. And he came through with a $50 subscription, which I am over the moon about and cannot tell you how much, Herb, I appreciate it. Emailed him. And if you haven't heard from me as a thank you, you should call me out right now and I will reach out to you. But I reached out to him, said, can't thank you enough. He got back to me, said, I got so much from stand-up Pete Dominic over the years. It's the least I can do. My wife and I talked about your situation, how COVID has been a double whammy for your family because you can't even do gigs right now. And I'll try to maintain this level as long as possible, at least through 2020. But I consider it my way of putting our stimulus money to work to help my friends. And I do consider you a friend. Just one I haven't met yet. And I'm loving the podcast. Herb, I'm loving doing the podcast. And I cannot thank you enough for your support. I cannot do the show every day without your support. By the way, how do you feel about me taking next week off? I'm still not sure what I'm going to do. I haven't had a vacation in a really, really long time. My kids are 12 and 15. My wife and I are taking them to our friends up in Nantucket. And I definitely want the time off, but I'm having such a hard time tearing myself away from doing this podcast and posting it every day. I need a break, so maybe I'll just load them up ahead of time if I can, but we're leaving Thursday morning, so I just don't know if I'll run out of time. Anyway, I hope that you'll understand if I take a couple days off next week to be with the family and recharge the batteries, but I'll probably still be posting because, well, you know me. All right, so let's get to a couple things I want to play for you. First of all, Yesterday, we heard in the White House press briefing a question being asked by Ryan Lizza of Politico, which was kind of one of those through the looking glass questions. It's one of those hard to believe this is America, hard to believe that President Donald Trump is the president, a game show, reality show star who cares about nobody but himself and is a white supremacist by every possible interpretation of the definition of white supremacy. But anyway, this is still the question. I think it's a fair one that has to be asked, given the president's defense of the Confederacy and Confederate statues, and including the Confederate flag. Here is Ryan Lizza of Politico asking Kayleigh McEnany a reasonable yet crazy question.
Does President Trump believe that it was a good thing that the South lost the Civil War? And then two, is he interested in following NASCAR's example and banning the Confederate flag at his own events?
Well, your first question is absolutely absurd. He's proud of the United States of America. Second, with regard to our statues, Americans oppose tearing down our statues. There's a Harvard-Harris poll released just last week that shows 60% of respondents said the statues should remain, and 71% said local governments should block groups from physically destroying the statues. So he stands on the side of preserving our history.
I mean, this just belies it's just so confounding that you won't even address the actual debate. Nobody wants to say, get rid of our history. Everybody, well, many of us want to say, and I'm going to look up that polling, many of us want to say, don't celebrate the worst people of our country's history. Preserve it, remember it, and make sure we never forget these people and what they did. But don't celebrate it. That's what a statue is. It's a celebration. It is praising a person. It is making them immortal. And kids look and they see statues and they think, well, that person was a hero. No, that person was a villain, a traitor, a slave-supporting monster, and tear that statue down. Boy, am I brave with that rant. Okay, I've looked it up, and Kayleigh McEnany is actually not necessarily wrong about public opinion on statues. Ugh, we suck. Americans say 51 to 34% they disapprove of displaying the Confederate flag in public places, but just 1/3 say they favor removing statues and memorials of Confederate leaders. Really, just 1/3? 49% are opposed and the rest are unsure. Well, that's crazy. 57% of majority of black Americans, but just 28% favor removing Confederate statues and memorials. That's got to be wrong. What person out there thinks that we should keep Confederate generals' statues up, much less their names on military bases, schools, parks, and streets? Come on. That's crazy to me. Well, anyway, I think it's got to be changing. I hope it does change, and I hope people just tear those statues down. Okay, what else? Joe Biden gave a press conference yesterday. Thought he sounded pretty good. I actually like Joe Biden. I think he's playing it well, and I've always kind of liked Joe Biden. I obviously disagree with many of the policies that he has supported over the years. I think he was wrong on many of those. I think that his vote for the Iraq War is reprehensible. But I think that he realizes that now. I think that people change and evolve and call me crazy and criticize my opinion of Joe Biden. But I don't think he's a terrible guy. I really don't. I think he's a political guy, but I think he's in many ways a genuine guy. And I have no problem with him being president. I think he's going to be the most progressive president of our life because he's going to be forced to be. I'm not that worried about his past record. Maybe I'm naive. Maybe I'm an optimist, but I'm for Joe Biden. Also, Dr. Anthony Fauci yesterday warned a Senate committee that the U.S. is, quote, not in control of the coronavirus and that infections could more than double to 100,000 a day if the country fails to contain the surge. Wow. Terrible, terrible news from the expert in charge, Dr. Fauci. And I'm going to talk all about it with Dr. Craig Spencer right now. Real special guy. Very excited to have him joining the podcast for the first time. He is an assistant professor of emergency medicine and population and family health at Columbia University Medical Center. He is an MD. He's also got his master's in public health. He's the director of the global health emergency medicine at New York Presbyterian. He also spent a lot of time in Africa and Southeast Asia as a field epidemiologist on a number of projects. He was on the board of directors of Doctors Without Borders. And during the Ebola outbreak in West African country of Guinea, he was there treating patients and contracted Ebola himself. Found out after he was back in New York for a couple days. It was a huge story that he had contracted it and that he'd recovered from it. He has now since treated hundreds of COVID patients at his hospital in New York City, and he has talked all about it. Great guy and a great conversation. His phone is going in and out a little bit, but I really don't think you're going to care that much about the quality of his phone connection at times, because the quality of the content of what he is saying is so good. I was riveted during my conversation with Craig Spencer. You absolutely should follow him on Twitter, where he's really outspoken, and you should watch the video that we talk about, which I've linked to in the show notes of today's podcast. Here now is Dr. Craig Spencer for the first time on Stand Up. All right, I've got him now. Dr. Craig Spencer, you come highly recommended. One of my longtime listeners, Dan McDonald, threatened me, as a matter of fact, if I didn't get you on. So I'm so glad that you agreed to join me today. Thank you so much.
Thanks for having me on. I'm looking forward to it.
So I just talked a little bit about your background, your story, but I'd love to hear it from you. And I'm sure you probably told us a billion times, billion different places. But tell me a little bit about that time you got Ebola while you were working in Africa.
Yeah, for sure. Actually, I haven't really spoken about it all that much. And it's funny now because I've been on the news a lot, and I've been on TV and on radio, and I've taken a bigger part of a public health platform, but that's all pretty new to me. In 2014, I was working in West Africa, got Ebola, came back to the U.S., survived, and then, had this potential to have a huge platform, gave one speech, and then basically disappeared because I didn't really want to talk about it. I wanted the world to focus on what was happening in West Africa as more people continue to die. So I'm really happy to share a part of it here.
Yeah, I understand that modesty. Like, you didn't want to be the story, and I understand why a physician would say that. But I think actually it's really valuable for you to share for a number of reasons. Some obvious, some not. But I want to go back to, when you became a physician, why did you just, your personal preference to go down the line that you did, and then end up working in global health and specifically responding to an epidemic like Ebola? How do you end up there?
It all started with a very strong desire to be a sharkologist, which it turned out doesn't exist. Someone really busted my bubble. I wanted to study sharks. I thought it was the coolest thing, like any 8 or 9 year old. That was my goal, my lifelong goal, study sharks. And then someone said, well, you actually have to be a marine biologist. And I was like, algae and plankton sounds really boring. I don't want to do that. So I had to find something new. And one day I was in social studies class, and I was looking through microfiche, which I imagine a lot of people have no idea what it is. But it was basically the internet on blue little pieces of plastic that we looked at beforehand under a big microscope. And I saw that a cardiothoracic surgeon made like $150,000 or something. I was like, whoa, that's the most money of any of the people on this blue piece of plastic. I'm going to do that. And so I committed my life 100% to becoming a cardiothoracic surgeon. I was the only 13-year-old, I think, that knew everything about an EKG, what a Q wave was, all this other stuff. And that's what pushed me to go to medical school with a stop in undergrad to study medieval history and the derivation of Romance languages, as is clearly crucial. And I went to medical school with the goal of, I'm going to be a cardiothoracic surgeon. I'm going to make a bunch of money. That's my goal. I'm going to do it. And I got that far and got into medical school and met a bunch of people that were going to do it with me, and ended up going on a couple international trips, moved abroad, and really lived abroad for the first time in my whole life. And it completely changed my outlook on what I wanted to be doing, the impact that I wanted to be making, particularly a trip I took to the Dominican Republic pretty early on in my medical career, and just seeing really the disparity between, what I was seeing in hospitals in Detroit, where I grew up and was at medical school, which, quite honestly wasn't all that great, but then going somewhere else and really just seeing so much of the need and really the impact that could be made by medical professionals all over the world. So I changed.
So more than anything else, it was that trip to the Dominican Republic and comparing what you saw there with their public health system to the U.S. and Detroit, like you said, which wasn't good. And I would imagine, that also being an island, you could compare the Dominican Republic to Haiti probably and see even worse.
Yeah,
but I have no idea
absolutely.
what I'm talking about. But
no, that's completely true. I mean, there was when I was down there, it was interesting because a lot of the same rhetoric that we use to talk about, people south of our border, they used to talk about people just to the west of them, and it was. I've learned so much from that trip, so much about how we respect other people, how we provide medicine, what is the best way to reach out, via public health campaigns, all that other stuff. But a lot of that came, I went down there as with the goal of being a cardiothoracic surgeon, and came back and said, I need to know how to take care of everyone anywhere, whether it's an old person with a heart attack, a woman, a baby being born. Like, I need to know how to do all this stuff, and I want to do it on a global stage. And that completely changed my focus, changed my intent. I came back and said, well, I have to be in the US for my training, so I'm going to be in the most, diverse place possible, and ended up doing residency training in emergency medicine in Flushing, Queens being the borough in New York City with, the greatest diversity of languages and people from all over the world. And it was great. I went for weeks at a time without speaking English, and had really people from everywhere in our emergency department. And I had my own little global health training here in New York City.
Yeah, a stand-up comedian friend of mine used to do a joke. I think it was Joe Matarese, living in Queens, in Astoria specifically. He said that people would walk around going, where'd that American come from?
What are you doing here? I used to always joke, because I lived in China. And sometimes I joke that, like, living in Flushing, Queens felt more like China than some places I went to in China that had, like, developed so quickly and started to look a lot more like, traditional American, KFC and McDonald's and whatnot. But it was an amazing experience. After that, I decided I wanted to get better and have more training in international and global medicine. So I did a fellowship. And it was really after that that I had committed to working with organizations like Doctors Without Borders, and had worked towards that. That's what ended up bringing me. It was just training, getting a master's in public health from Columbia University, where I did a lot of work just kind of studying disease outbreaks and looking at mortality and why people are dying in certain areas. Spent a lot of time living in East Africa, in a small country, Burundi, making a lot of relationships, making friends there. And really just learning about public health and the intersection of public health and really society and epidemiology. So it was a really incredible experience. It gave me a lot of tools, and it really gave me the training that I needed when in 2014 we saw what was happening in West Africa, and there was a need for people who had experience taking care of disease outbreaks, people that were willing to go to a place like West Africa where this disease that was killing 80% of people. And I happily put my name on the list and did the training, and ended up in Gekadu and in Guinea, the epicenter of the outbreak.
I bet I bet the difference between maybe the funnel of people, the physicians that go into qualified, and how many come out that are labeled willing, was probably a real narrow funnel. I mean, there's a lot of people that can do that type of work, but there's not as many people who are willing to go into a war, which is what this is, where you can die a horrible, horrible death. And yet, for whatever reason, luckily, you and others like you decided to go, and you're in Guinea. And what happened? What was that like?
It was absolutely, it was crazy. It was horrible, so many people infected. I was there in September, October, when things were getting really bad, when we started hearing about people who were at the doors of Ebola treatment centers and couldn't get in. We had such widespread transmission of the disease. We're having such a hard time convincing people to come into treatment centers and to take the precautions that were necessary to stop the spread of this horrible virus. It was unlike anything that I'd ever seen. We would talk to patients in the morning, get all dressed up in the personal protective equipment, have a really nice conversation with people that appeared well, and then come back in the afternoon and they'd be dead. Every single day there were people dying. Every single day, old people, young people, pregnant women. It was absolutely horrible, and it was nonstop for me for weeks, but for many of the people that lived there for years. So that when I finally came back to the U.S., I was understandably pretty shell shocked, pretty depressed, and really just incredibly sad with everything that I had seen over the span of that, past month and a half that I was there taking care of patients.
Anybody who does what you do has to have a kind of special bandwidth to deal with the emotional part of it. And I would imagine it's almost like a tour of duty. I keep thinking about it in terms of combat, not that I know about either, but you did a tour in West Africa, saving lives of people who were contracting Ebola. Then you actually contracted it yourself. You were diagnosed with it after you came back to the States. There's a huge story, of course, about that, the reaction in New York. And then you're on another tour because now you are treating patients in New York who have COVID-19 and at the peak of it, and God forbid it comes back, but in March and April. So you've done these kind of two tours, but just going back, I mean, your contraction of Ebola, how do you look back on that? I don't know what the specific question, Dr. Spencer, is, but the fact that you contracted it yourself after treating people and after you'd come home, how much do you think back on that time?
Actually, not all that much. I mean, it was 6
sorry
years
to make
ago.
You too, then.
Yeah, no, it's okay, because I think that there's a lot of learning from that time,
right.
Not just in my story, but like the way that we responded as the U.S. and as the international community, and how that really kind of set us up, quite honestly, for failure in COVID. So I think reflecting on it is really important. I teach a class called Lessons Unlearned in Humanitarian Response, because often we don't reflect back on these things and we make the same mistake over and over and feign surprise when the results come out the exact same. I reflect on it, one, as like a daily reminder of, hey, I'm really happy to be here. I'm happy to be alive. But also, two, to look at the mistakes that we made at that time. The international community in the United States were super slow to respond in West Africa. We kind of drug our feet to get involved. And when we did, we were haltingly involved. And the result was that the disease spread around the world. More people died in West Africa. And there were a lot of people who said, listen, this was a huge mistake. There were people like myself getting sick. There were a lot of people in West Africa, thousands of people that got sick. 11,000 people died. So we can't let this happen again. We need to have better systems in place. And we put them in place here in the U.S. and internationally. And I'm happy to get into this more, but like once we ended up having this COVID pandemic hit us here, particularly in the U.S., a lot of those systems were either unprepared or had been taken apart over the span of the past couple of years, because, we often unlearn those lessons. We often think, well, this is a lot of money we put into something that we don't need anymore. Let's pull it out at the worst possible time and hope for the best.
It's interesting to sidebar, take a look at a country's budget and see how they spend their money and how much they need the things that they're spending the money on and how much they might not. And then you can talk about corruption and having the wrong interests and so on. But I always use the example of a city like Atlanta. Investing in snowplows would be a waste of money. They might have an ice storm, but it doesn't make sense to have snowplows that spend a lot of money on that when you have a limited budget. When you look at the United States of America, when it comes to the response to a pandemic, or frankly any other public health issue, which we could speak to about and the needs, the demands, the populations, and so on, but specifically when it comes to viruses and all of the things that you're an expert on, and so many other thousands of people around the world in the global health community are experts on. I just wanted to get your kind of personal, emotional take on the idea that this President Trump or anybody else would act like we'd never seen anything like this. We didn't know anything about this. This idea of surprise of a pandemic, it must be more than outraging. There must not be a word to describe your reaction to that, seeing as that you've made it your life's work to understand viruses, how they behave, and what the public health response should be to them and how we should be prepared. How do you respond to him or anybody else saying, we never seen anything like this? We just, we couldn't have been prepared for this.
My response is that this is exactly what all of us have worried about for quite some time. I remember in 2014, 2015, when I came back, there was so much worry that Ebola was going to spread across the country. There was one survey that was done that, the majority of Americans thought that they or someone in their community would get and would die of Ebola. Like there was so much fear Ebola going around, despite the fact that there was like zero chance.
Fear Ebola. Why was that? Why were so many people afraid? Media?
I think part of it was media. Part of it is just a really scary disease that I promise you don't want. But I think the combo of that was like, I looked at it, many of us looked at it, Fauci, other people that are much smarter than me said, yeah, okay, Ebola is bad if you get it, but like, it's not going to cause an epidemic in the United States. Like, it doesn't work like that. We have running water and we have personal protective equipment and we have isolation and we have all these other things in place that'll prevent that from happening. What really scared everyone was this, possibility of a respiratory virus that was easily transmitted and didn't kill a lot of the people it infected, but killed some, but could, infect millions and millions of people all over the world in the span of a couple months. That is the stuff that everyone worried about, has been worrying about for years. And so once this pandemic came, once the novel coronavirus came, like, this was everyone's worst fear that everyone has had for quite some time. We knew that this was going to be the big problem, not Ebola spreading from a village in Guinea. That's not going to take over the world. It's not that good of a virus. Coronavirus, the COVID, the virus SARS-CoV-2 that causes COVID, is, for lack of a better word, a perfect virus. It's so good at what it does. It infects a lot. It transmits before many people have symptoms. Some people don't have symptoms at all, but are infecting others. It doesn't kill that many of the people that it infects, which is good for the virus because then it can continue to spread. Like, it's perfect. This is the thing we've worried about. There have been tabletop exercises on this every year, including at the level of the U.S. government. There was a pandemic playbook that was left in place by people like Ron Klain, who was the Ebola czar, in place, while I was in the hospital. This is no surprise. This is no surprise to anyone that has any insights into what's happening on the global public health stage, on the biosecurity stage, really on the pandemic preparedness stage. Zero surprise at all. So to hear people being like, wow, I had no idea this was going to come. Well, a lot of people did. And unfortunately, those are the people that were let go or fired. The
perfect virus is how you describe it and in detail as to why it is. And, I think the question, one of the reasons why a lot of people in the media want to talk to you, Craig, is because you treated Ebola and you treated COVID-19. You could talk about the differences. And you've talked about the differences a little bit here, but let me get nerdy with you and just ask you about the R0 measurement and the difference in the R0 with Ebola versus COVID-19 and why that seems to matter so much.
Yeah, for sure. The big difference is that, Ebola we saw was being transmitted. It was a disease of compassion. It was being transmitted to family members that were taking care of really sick people, sick patients. People during these traditional funeral practices as they were preparing the body, things that necessarily needed to happen to many communities and cultures in West Africa. And we saw that these were the people that were primarily being impacted. You needed to have this close contact with the bodily fluids or the blood of someone that was infected. With COVID, you don't have to have that. There's no asymptomatic Ebola patients. Like, you get Ebola, you're lucky if you survive. You're definitely going to have symptoms. But for a lot of COVID patients, we know that a lot of them, a significant percentage of them, will have no symptoms at all, so will not know that they're sick. They can transmit this via respiratory droplets. So even just casual conversation, definitely through coughing, but even through other means. And the result is that, if you see someone dying from Ebola who's extremely sick and having a lot of diarrhea or bleeding or whatever, like, you're probably not going to go up to that person and extend a hand, quite honestly. But if you see someone who looks completely fine, is doing okay, without knowing that they have COVID, like, maybe you'll shake their hand, maybe you'll get close to them, maybe you'll get in the elevator with them, maybe you'll take off your mask to talk to them. And that's what makes the big difference between this, is that it spreads so well. And really a lot of the things that we need to do to prevent it from spreading, we're not all that great at, like not touching our face. The virus gets on surfaces or gets somewhere and you put it onto your face and it gets into your mucous membranes. Wearing a mask, there's still a lot of people that just don't want to wear a mask, despite the fact that it can reduce the amount of virus that goes out and hopefully some of the virus that could come in and infect you. So they're very different in that one is a respiratory, the one that causes COVID is a respiratory. The other one is primarily through bodily fluids and it's much harder to get, i.e. Ebola. There's a lot of difference between the two, and that just the transmission around them. And that's why it makes it so much easier for people to get SARS-CoV-2, the virus that causes COVID.
You treated people.
That make sense?
Yeah, all makes sense. I take a dramatic pause sometimes to let listeners hear the all the details you just said marinate, because it's a lot and it's important that people understand it. Sorry, but yeah, it makes a lot of sense.
No, it's good. I talk about it so much, and I don't know if I'm getting the right bullets, if I'm making it clear.
Well, believe me, I'll let you know if I'm confused. This is a very layman show.
Keep me accountable.
I'm not trying to impress anybody. The fact that I said are not just shows that I prepare, but I don't really know.
I was like, wow, we're throwing on are nots here. Okay, well, thanks. Let's talk about some epidemiology.
I mean, if you'd thrown a bat to me in the future, you should be like, well, what do you think about R naughts? I would have thrown up.
Tell me what you think about the reproductive number.
Well, 7. Moving on. So you treated a lot of people with COVID-19 in New York City, and you saw a lot of people die, didn't you?
Yes. Yeah.
You talked about it. Someone actually even mocked up like an animation, a video of you talking about it. It's gone viral. It's really, I'll share it in the show notes and on social media. It's really important and impactful. Tell me a little bit about that, though, that experience.
Yeah, the way that I've been describing it and writing about it and talking about it is like, quite honestly, like walking over that threshold to get into the emergency department. Sometimes it honestly felt like walking into the apocalypse. I remember one day walking through the ambulance doors, I get my mask on, I have my goggles on, I'm, ready to enter this kind of cage of contagion where this virus seems to be just running amok. And I come in and, the week before it was just, I describe it as a cacophony of coughing because it was cough, cough, cough everywhere, different tones, different sounds, but coughs coming from everywhere. And then like the week or two later, it had just morphed into this silence. And the only thing you heard were the monitors that were going off for every single patient who was on a bunch of drips, a bunch of medicines, who was on a ventilator, and just walking into the emergency room and seeing dozens of people not breathing by themselves, but being breathed for, through a machine is unlike anything that I've seen in the emergency department, especially here in the United States. It's so unsettling. It's so jarring. But that became a reality really, really quickly. And that's just still something that I think we're all trying to get our heads around and try to recover from. I went home one day and that video you're talking about, the one made by AJ Plus, was based on a Twitter thread that I wrote over the span of 20 minutes and a glass of whiskey after a shift. I sat down. I said, people have been asking me what it's like in the hospital. Let me just go through and give you a quick rundown of what we did today, which to me didn't seem that remarkable. But now I look back and I look at the comments and I talk to people. And that was a time that people really needed, the end of March, really needed to know what was happening. People didn't understand this disease. People didn't know whether they should fear if it was real or what was going on. And so apparently writing something like that really resonated with so many people who weren't able to peek inside the hospital and see what we were seeing, what was quickly becoming our reality. So I'm really glad AJ Plus, took the time and put the resources, huge manpower resources, a lot of money, I'm sure, into making that video, because we haven't had a peek inside hospitals. A lot of other people that aren't doing what I'm doing on a daily basis don't know how bad it is and how horrible it is to watch people die, to hold their hands as they die, to turn off a ventilator, or to call someone's family on FaceTime so they can have those last couple of minutes together. I'm glad that we're able to share that, because if people don't recognize the reality of what's been going on, they're not going to take it serious. And they don't take it serious, this is just going to continue for many more months.
What I've heard from experts, everybody should go watch that video. I'll share it, and maybe I'll even play a little bit of it. I don't think I'm allowed to play all of it. I want all the credit to go to the hard work, because it's a really good kind of animation that goes along with your sharing such important, honest, vulnerable moments. Being a physician, it was extremely moving and really helped me understand what it's like and why folks like you deserve our support and resources in so many ways, which is, of course, why it's so maddening and frustrating and challenging to understand the federal government, especially the federal government's response, some of the media's response, and certainly some of the state government's response. And so what I hear from a lot of public health experts is basically we know a lot, not everything, but we know a lot about what we need to do. It's going to cost a lot of money, but we know what to do, and we're not doing it. We don't have political leadership, the type that we would need, and I'm sure the type that you've seen in cities and states and other countries where you have worked. It must be really hard to know what we need and to have a pretty good understanding of this virus. Still, there's a lot that changes and evolves, and I think we need to admit that. But to know what we need and to not have that because of politics and and interests that don't align with those of you and what should be the only thing that matters, public health and science. And we certainly have enough money to deal with it. How would you identify, Craig, what the major mistakes have been and continue to be?
You're right. It's really friggin' frustrating. In 2015, I wrote a piece in the New England Journal of Medicine, some reflections on my Ebola experience and the way that I thought we had politicized public health in the aftermath of that, talking about mandatory quarantines and all these other things that didn't make sense from a public health perspective. But my infection happened around the time of a midterm election. It was politicized. People were calling President Obama, the President Ebola Obama, or the Ebola president, or they were saying that Al Qaeda was going to infiltrate the southern border with Ebola infected people. Like, so much of what was happening was politics and it was not public health. And that's why we responded so poorly then. I was angry, but that pales in comparison to what I'm seeing now. You talk about not having the political leadership. That's one thing, but not allowing the politicians to amplify and put in place public health leadership, to have the message from the CDC, from people like Dr. Fauci, from the people that should be in charge and should be making these decisions. That is what is most concerning to me. I understand that politics are public health and public health is politics, but we are failing so much in this country in our response to COVID because we have put politics over public health. If you look at all the other places around the world, New Zealand, really every other country that has flattened the curve and decreased the cases, they've put they put public health over politics in guiding their response. And the result has been that they have not had these huge increases in cases after they already had one set of increases, a couple of months ago. They've gotten this virus and this pandemic much more under control. So, yeah, it's super frustrating to see politicians drive a narrative to gaslight, quite frankly, a public about the reality of what's going on. And it's even more frustrating because I don't understand what the end game is. I'm like super perplexed. Like, if the goal is to get the economy back up and running again, the only way to do that is to get rid of this virus. We can't just pretend that COVID isn't here and that your grandma just didn't die. Like, we need to get this virus under control if we want to have any shot at getting back to a relatively new normal of life, like a lot of other countries are already starting to do. When we struggle with record high number of cases on a near daily basis over the past week, it's just the disconnect between the reality of what we need to be doing and whatever the goal is of this administration is such a wide chasm. And this is not my personal political beliefs. This is my understanding as a public health professional. What we need to be doing is not being done. What we need to put in place to stop the spread of this virus is not being done. I think the argument is that we need to get the economy running again, but there's no way that we're going to be able to do that until we get this virus under control. And what we're doing right now has a near zero chance of doing that.
Yeah, I mean, you don't have to be an economist to understand that people are not going to go to your restaurant or go out and shop if they're afraid. They're just not. Yeah. And there's no politician that's going to make them feel better. There's no if people are afraid to go out, they're not going to go out. And yeah. So that's why you have to get the virus under control so people will be feel comfortable enough to go out and to shop and to do all the things that we normally do. So
no one's going to go like have a fine Italian meal atop a trap door. Like,
well, they're not going to go to
people know better,
right?
Know?
Yeah,
well, I'd say the majority of people know better, but a lot of people are taking guidance from politicians because we have not amplified public health professionals. We don't know who to believe. Is it like, do we listen to the president who we're supposed to listen to, or do we listen to this other guy who is also really important, or do we listen to the CDC, but we haven't heard from them in a while? People are looking for advice, and all they're seeing are politicians' faces who have different motives than the public health professionals. I keep hearing like, oh, you public health people, you just want us to stay locked down, and you don't want us to have any fun, and you want us to go out to dinner, and you just don't want us to die. And it's like, no, we want an economy that works. My family has been crushed by this virus, like crushed. My mom lost her job. My dad had his hours cut. Every single person in my family has been economically just like destroyed by this. I get that point. I get that argument, but like delaying the inevitable, like putting off real action, is only going to make that pain much, 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 much longer. And we're starting to see that.
Given your experience with Ebola in West Africa and given your understanding and education on pandemics, what are you what are you most surprised by in terms of the reaction of the public? I think about the fact that, masks have gotten political, or social distancing, or I don't know. I mean, what are you most surprised by in terms of the reactions of Americans specifically on this?
I think there's a couple things. One, there has been, and this was true in the Ebola outbreak in West Africa, I mean, there's just been this outdo influence, or outdo introspection, or really focus on what's happening here in the U.S. without insight into what's happening all over the rest of the world. Like, the U.S. has long been a global leader in health security and in global public health, and we have basically just given up on that and stepped back. The threat to defend the World Health Organization, which would, in the middle of a pandemic, is just pure lunacy, regardless of what your thoughts are about the WHO and how they responded in China, which was, again, imperfect. But like this focus so much internally, I understand as like a self-protection mechanism. These are the things that we need to focus on, a domestic response. But we're not going to be safe here in the U.S. until the whole world is safe from this virus. Remember, we didn't know anything about this until early this year, and in the span of half a year, this virus has gone from, a wet market in China to Italy to a bunch of other places, and destroyed communities, killed a lot of people, and ended up here on our shores so quickly. If we think that, we'll just kind of, wipe it out here, either through some ill-fated attempt at herd immunity or trying to get it under control through other means, and then we'll be okay. This virus is going to continue to circulate all over the U.S., all over this continent, and really all over the world until we have, an approach that's focused more on global solidarity and not just on U.S. exceptionalism. I also think that, it's interesting, this discussion around masks is not being discussed, is not the same in many other countries all over the world. Like, you look at places like Japan, where masks are not mandated at all, but the overwhelming majority of people wear them. One, because they know that it can help spread, it can help prevent the spread of this disease, but also it's just more of a societal outlook of like, I protect myself and I'm protecting other people. I get that people don't want to wear masks. I get that a lot of the communication on masks early on was not great. And I think we as public health professionals need to own up to that. A lot of people said, you don't necessarily need masks, or maybe they do more harm than good, or maybe they help, maybe they don't. We didn't really know. And we've had, obviously, what science does, it's an iterative process where we learn more and then we change our recommendations. And since then, we've realized, actually, we should have been telling people to wear masks really early on because they work. And we need to be really good at saying, we kind of messed up, but we know that this works right now. Definitely need to trust us. And there's a lot of people who are like, I don't necessarily trust you. You messed up before. This other person is going around the country holding rallies and not wearing masks. So why do I need to wear one? I think a lot of it is, setting a precedent. Our leaders need to really step up and set a precedent and really be an example for the few things that we know that actually work to stop the spread of this virus. One of them being wearing a mask, which helps protect you and helps protect others.
All right. Before I let you go, and do you get annoyed by being asked to make predictions about the virus? Is it annoying because it's like we just don't know and you don't want to say? Or
I mean, it sounds like you already heard my answer. No, it's not. I mean, I think there are some things that we can predict. There are a lot of things that we don't know. And again, right now, I've taken care of hundreds of COVID patients. I feel like I know a lot about it. I know a lot about public health. But right now, there's still so much more about COVID that we don't know than we do know. And that's okay. This virus has been with us in less than half a year. We don't need to, and we shouldn't expect to have everything figured out by now. What we do know, based on previous pandemics and previous outbreaks and previous respiratory illnesses like this, is that if we don't get this under control, if we don't do the things that we need to do to prevent this virus from spreading, it will continue to roll about this country to cause, economic havoc, to cause more cases, more infections, more deaths. That is 1,000% certain. I'm very, very clear and happy to continue to predict that. a lot of the other stuff, we just don't know. Is a vaccine gonna come and be the savior of all of us? Maybe, maybe not, and probably not as soon as many people hope for. The one thing I remind people is the fastest we've ever made a vaccine in history was in the 1960s with the current mumps vaccine. I think we will get to a vaccine. We will have something that works pretty soon, probably by the end of this year, and we will likely be vaccinating, hopefully, frontline healthcare workers and other vulnerable populations in that, pretty soon, either the end of this year or early next year. Will that vaccine be perfect? Probably not. Will it provide 100% protection against immunity? No. Will it need maybe 2 or 3 doses, diminishing the amount that's available for the rest of the world? Maybe. There's a good chance of it. Will there be other vaccines that come along in further years that will be better? Probably. We very rarely get the moonshot on the first attempt. And we also, already have in this country a lot of people who are not going to get vaccines, who refuse to be vaccinated.
Well, that was my big question. The big question is not, you're sticking to the science, and I would focus on the biggest concern is the culture of conspiracy theories in the United States of America. And I'm one who believes that now a frighteningly large percentage, and maybe even a majority of Americans, buy into a lot of the crazy bullshit about vaccines, and especially if they are all focused on this and terrified of this. They're watching the vaccines being made, and they all have different sets of information, and they don't trust this president, or they believe these crazy conspiracies, and they'll say, I'm not getting it. And if they don't get it, Craig, what does that mean?
Well, I think there's a couple of things that we should unpack there. One, I love vaccines, and I don't think I need to be very clear about that, but I get excited when I take my kid to a pediatrician, like, cool, we're going to get diphtheria shot today. Awesome. Because I saw a kid die of diphtheria once, and it really sucks. I'm very excited when I get vaccines for my kid.
You're going in and a lot. I think you're moving a little bit, Craig. You're going in and out a little bit. But
oh, sorry. I'm getting really worked up about vaccines.
Just keep your mouth right in front of that phone. I hear you.
Yeah, for sure. No, so when, I've seen people die of tetanus. I've seen these horrible things. So to get vaccinated, I love it. I think it's great. So I'm clearly biased, unsurprisingly, in favor of vaccines. But I think you're right. There's a big contingent of this country and of the world who refuses to take and to use vaccines at baseline, despite the fact that we know they reduce mortality and they do all these other wonderful things. So we have to worry about that. The other thing that I do really worry about, though, is that we have this Operation Warp Speed, where we're going to make the vaccine faster than we've ever made it, and we're going to be doing multiple stages at the exact same time. And I could understand how people who are already reluctant to get vaccinated will see this process and say, hey, we did something that normally takes a decade, and we did it in a year, and have concerns about the safety of it, about whether or not they want to get vaccinated or get this vaccine for their kids, especially if they're in communities that haven't yet been hit hard by this virus. It's going to take a lot of work by public health professionals, but also politicians and people in charge to convince people, one, that this process was done with respect to the safety and the same processes that we've done in the past, but two, that this is what we need to prevent this pandemic from worsening. Because if we don't have a vaccine, we continue to have, for lack of a better analogy, a bunch of firewood for this virus to burn over the coming couple months, and then really the coming couple years. This virus will continue to circulate until it runs out of people to infect. And the only way that happens is if enough of us get infected and then we have some immunity, which again we don't even know actually exists, or if we get a vaccine and the overwhelming majority of the population gets immunity that way and prevents the virus from being able to spread. So without a vaccine, without enough people getting the vaccine, even if we have one that's 100% effective, we're still going to be at risk of this virus causing some pretty profound societal impacts for the next couple months, the next couple years.
We'll leave it there. Craig Spencer, Dr. Craig Spencer. Follow him on Twitter. All the information for Craig is in the show notes, including a link to that video we talked about. I cannot thank you enough for your time, and I feel like I got a new friend, and I hope to do part 2 whenever you're available. Thank you so much for your heroic work along with all of your colleagues, and we're going to need a lot more of it. So whatever we can do to support you, let us know.
Absolutely. And hopefully next time I can come on and be hopefully not such a downer. So, I hope I've got more good things to report on.
Well, do you want to end on something higher, on something special? Why don't you tell me about your child and what you're, just parenting, something funny your kid did or anything else.
Absolutely.
I mean, any happy story out of COVID-19, which I'm sure there are probably plenty of. Let's end on a high note. I agree with you.
Absolutely, and I appreciate that. And I think that there are high notes even within COVID. Like we have some therapeutics that might work, decrease some mortality. We're getting better at treating these patients. Like there's some good things that are coming out of this bad scenario. So it shouldn't be all me, Debbie Downer. I just, the past couple of weeks have left me a little pessimistic.
Yeah.
That being said, I have spent a lot of time with my family and with my daughter, and much more than I would have otherwise if I was just caught up in this churning mill of, clinical work and publishing and research and writing op-eds and doing podcasts. Like I've done something that I think a lot of other parents around the world have been doing, which is spending more time with their family and with their kids. And I've been able to teach my kids stuff and recognize that after having read her this same book for, the past couple of weeks, now she can read it to me, and she's just a year and a half. So it's been really wonderful.
Wow.
I've learned a lot. Yeah.
Your kid can read a year and a half?
Well, I mean, she looks at the pictures and she's like, oh, that one's Fuzzy Furphy. And I'm like, yeah, you're right. It's Fuzzy Furphy. But everyone's like, oh, your kid talks a lot. I'm like, well, she's spending 24 hours a day really locked up with two overeducated professionals. Like, I could understand why she probably has
I'm really happy to hear that you have been able to spend this time with your daughter. And if anybody deserves it, you do. And so it's great. I don't know who this furzy communist is.
Dr. Seuss foot book. Yeah, it's a good one.
All good stuff. That's great and great to hear. And now we did end on a good note. Thank you so much, Craig Spencer. Really appreciate it.
Thanks for having me on. I love it.
Oh, man, wasn't that awesome? Wasn't that fantastic? Craig Spencer, you got to watch that video. I'll link to it in the show notes for this podcast. He's on Twitter, by the way, at Craig_A_Spencer. Real cool guy. We actually talked for a while before, got to know each other a little bit and really hit it off as well as after. And hopefully that means he'll join me again in conversation because a lot to learn, a lot to reference from that guy. I'll try to get him on every month at least. Craig Spencer. Whew. Good stuff. All right, moving on. Now it's time to talk about a very different issue, poverty, specifically the Clean Slate Initiative, which is led by my good friend Rebecca Vallas. And it's a very important idea, basically the belief that if you work hard, you should be able to get ahead. Remember that idea? That doesn't seem to be a real idea. Well, a lot of people who have any kind of criminal record can't. They can't get ahead. Those with criminal records who have made mistakes for any number of reasons. I mean, I don't even know if I always call crimes mistakes. Sometimes people just don't know better. They don't have the right role models. They don't have the right opportunities. And the idea that it's a mistake or that it's a choice, it just doesn't. I think there's a lot more to unpack about why people commit certain types of crimes. But if they've paid their debt to society, if you will, and now they want to contribute to the economy and to the social fabric that is America, don't they deserve that chance? The CleanSlateInitiative.org is what we talk about today with Rebecca Vallas, who's on Twitter at Rebecca Vallas. You should absolutely listen to her podcast, which is called Off Kilter. You can find it anywhere where you find the podcast. I'll link to that in the show notes as well. Here is our conversation with my good friend and one of my heroes, really, Rebecca Vallas. I've got her now, the great Rebecca Vallas. Thank you so much for joining me again. Everybody loves when you are on the podcast. You are one of the greatest guests. Hi.
Hi, Pete. It's a total pleasure to get to spend some time with you, even if it's not in person, although I do look forward to when that's a thing again, because I miss you.
Well, I miss you too, and it's sad that we will never see each other again. It's never gonna end. This is just the way life is. Deal with it.
Glad to see you're still an optimist.
No, I am. The uncertainty kills me. It's like when you say that, it's like, yeah, I'd love to see you. When is that going to happen?
It's so hard to know, right? I mean, and we're watching these surges in places like Florida and Texas that had done these kind of boneheaded reopenings that everybody said were going to be a bad idea. I mean, who knows? But whenever it happens, you are high on my list for humans that I want to be in a place with as humans.
Likewise, I can't wait. Lots to talk about with you today, but tell me about this initiative that you've dedicated a tremendous amount of your time to and work to and have gotten results, because this is good news. The Clean Slate Initiative. What is Clean Slate?
Yeah, it's such a cool thing to actually get to be talking about good news for a change, I feel like. And that was why when you reached out and we were talking about what we might talk about on your podcast, I was really excited to get to finally talk about something good. So the backdrop here, and I feel like folks who have heard me on your show at points have probably heard me talk about this. Back when I was a legal aid lawyer, which is what I did before I was a policy think tank person in D.C., a lot of my clients were people who had criminal records that were following them, kind of like a scarlet letter, for a long time after they had completed their sentence. And so I, as a legal aid lawyer, learned very quickly that a criminal record in many ways can be a life sentence to poverty that no judge ever handed down to anyone. Even in the case of really minor records, even in the case of like arrest records that never even led to a conviction. Obviously, felony records are even more serious, a stigma. And so what I saw with my clients was that having any kind of criminal record could mean that your resume would be thrown in the trash if you were applying for jobs. Your housing application for, say, to rent an apartment would be thrown in the trash because of your record. Having a record effectively would follow people for the rest of their lives. And that is a big part of actually what legal aid lawyers often do. A big part of what the organization I used to work with in Philadelphia, Community Legal Services, did a bunch of, was helping people clear their criminal records, get their records expunged or sealed. There's different words in different states. And so cut to present day, an idea that I and some legal aid leaders that I used to work with in Philly came up with several years ago was to basically make it a lot easier for people to get their criminal records cleared by using technology, using automation, so that people didn't need to find a lawyer, who most people are never able to actually get help from, because we're talking about folks who overwhelmingly can't afford lawyers. Pretty much anybody, right, is what this clean slate idea can get their record cleared if they're eligible. And so what we did was to actually pilot this idea in Pennsylvania. It became law, something called the Clean Slate Act. Community Legal Services in Philly had a huge role to play in designing how it was going to work. And this became law in 2018. What it meant was that people with criminal records in Pennsylvania that are eligible to be cleared could get them cleared automatically, instead of having to file a complicated petition, instead of needing to go in front of a judge, get a lawyer, and pay expensive filing fees, all those things. So that's this Clean Slate Act that was a really good news story of a couple of years ago, 2018, when it became law in Pennsylvania. But the reason that you and I were just talking about this, and the kind of big good news that is happening right now this week, is that we finally, now that law has been in effect for a year, it took effect in 2019 in June. Now it's been in effect for a year. We're celebrating the 1-year anniversary of that. It just happened this past weekend. And now we finally have some numbers to tell us, how is that law working? How many people have been helped? And here, drum roll please, is the kind of good news. And that is that 35 million cases in Pennsylvania have now been automatically cleared, and 1 million Pennsylvanians have been able to get their criminal records cleared, allowing them to move on with their lives and finally have a fair shot at jobs and at housing and all the other things that previously had been blocked because of those old records. So huge good news from Pennsylvania this week. A ton of celebrating going on with the Governor Wolf, who signed that bill into law, and the bipartisan lawmakers who all work together to make it happen. And it's just tremendously exciting in this moment where, as we're now in the middle of this tremendous recession caused by the coronavirus pandemic, and we're all kind of wondering, what is recovery, what does rebuilding look like on the other side of this pandemic? this kind of policy making and the kinds of good news reports that we're getting out of Pennsylvania now that this Clean Slate Act has taken effect and has started to do its thing, functionally what that's going to mean is that Pennsylvania is leading the way in making sure that people who have been impacted by our broken criminal justice system are not unjustly, unfairly held back and kept out of the recovery when we are able to see jobs start to reappear. So that's a little bit of the good news. And there's a ton in there to unpack, but there's also more good news that comes on the heels of it because of the trend, the sort of movement that Pennsylvania started and that now a whole bunch of other states are all starting to follow in its footsteps by trying to do clean slate laws of their own.
cleanslate.initiative.org for more information. But let's unpack just a couple of the things. At the website, it says 1 in 3 Americans have a criminal record. 9 in 10 employers use background checks in hiring. 1 in 2 children has a parent with a criminal record. And there is $87 billion in lost GDP every year because people with records are shut out of the labor market, which, of course, takes a huge toll on the U.S. economy. But let's just look at the fact that employers use background checks in hiring. Rebecca, what is that sound of nature? That is beautiful. What is that?
You're hearing birds, Pete. I know that may be an unfamiliar concept to a New Yorker like you.
No, I live in the burbs now. I love it. I just was trying to name that bird. I get so excited. Anyway, the employers thing. How do employers, why should employers not be able to see someone's criminal history background before they hire them?
Yeah, so this is really kind of at the crux of it. So I was telling you about some of my clients who I used to represent back when I was in legal aid who were facing these criminal records and the stigma that went along with them for years after they had completed their sentence, moved on with their lives, and then they just functionally weren't able to be able to participate fully in society because they hadn't really had their rights restored. I should note, this makes the United States really, exceptional. People like to talk about American exceptionalism, exceptional not in the good way. Pretty much no other countries, developed countries, treat their criminal justice system and the people who flow through it in this kind of a way. Take Germany, for example. As soon as you get out of prison in Germany, all of your rights are automatically restored. The right to vote, not to mention, the right to have a fair shot at a job or at housing, all those things. The rest of the world looks at the U.S. and says, what are you doing? Saddling people who you're churning in and out of your bloated and broken criminal justice system. And then after they have completed their sentence, whatever that looks like for them, what are you doing? Not even restoring their rights. What are you doing? Holding them down for the rest of their lives. What we've effectively done in the U.S., and this is a part of our broken criminal justice system that really doesn't get nearly as much attention as some of the other kind of more visible pieces, we're functionally creating, and we have created over the decades, a permanent underclass of people who, and it's the people with records, but it's also their families, their kids, their loved ones who get impacted, not just for the period of time that they were given a sentence for, but indefinitely. And the thing that is most boneheaded about this, in addition to all of those statistics you were mentioning, is that it isn't just incredibly harmful for the people with the records and their families. 1 in 2 kids, I should note, have a parent with a criminal record, So huge issue for thinking about kids and kids' future chances. But it's also really boneheaded from an economic perspective. And so you were reading the statistic, and this one to me sort of sums it up probably better than almost anything. Not only is this tremendously damaging for the individuals, for their families, and for entire communities that have been over-policed, that have been over-incarcerated, over-criminalized, largely, obviously, Black and brown and low-income communities, but it's also something that is causing us as a country to take a huge bite out of our own economic growth every time we shut people with records out of the labor force. And economists have looked at this and have said, just looking at the people who are kept out of the labor market because of felony records, not even all those other types of records I was just describing that can be huge stigmas in the employment arena. But just shutting people with felony records out of the labor market is costing the U.S. as much as $87 billion in lost gross domestic product every single year. And so with everyone talking right now about how do we rebuild, how do we get our country back on track economically, and most importantly, how do we remove barriers to people returning to the workforce, that is what record clearing is all about. And most states already, and Pennsylvania was one of them, have on the books ways for people to get their records cleared, but almost nobody is ever able to successfully navigate those systems if they can't get help from a lawyer and, afford really expensive filing fees, as I was mentioning. And so what that ends up meaning is that about 95% of people who are currently eligible to get their records sealed or expunged or whatever in the states never get their records cleared. That is why we've seen all this tremendous support for taking what Pennsylvania has shown can be done technologically and bringing it to a whole bunch of other states so that we can allow people to return to the workforce, be able to find safe and stable housing, and be full participants in society once they complete their sentence. And all of that is actually going to be good for us economically, in addition to rectifying a massive injustice that we've been allowing to go on for decades.
The economic argument seems to be the most important argument because the moral argument doesn't necessarily sit the same way with every American, I would assume and argue. And I wonder just about how you get bipartisan agreement on something like this, because without saying the words conservative or liberal, I guess I'm insinuating them, there are some of us that don't necessarily believe that your behavior will change as a result of some consequence or punishment. There's a movement called restorative justice that's really interesting that looks at this, and I'm sure you're familiar with that, and I'm sure you're familiar with all of this stuff. But I mean, you understand as well as anybody that a lot of folks, believe in consequences and punishment, and that you should have to go to prison for many of these ideas and issues, which is, pretty crazy because in this country, we have the largest system of human incarceration on earth. We have 5% of the world's population and 25% of its imprisoned population. And so how do you convince people who subscribe to the idea that punishment and consequences for a crime, regardless of the crime, and if we agree or disagree that it should be a crime, how do you get them on board with the clean initiative?
It's such a great question. Initiative. It's such a great question, Pete. And, I think one of the things that has made this area of work a little bit different for me than a lot of the other stuff that I sometimes come on your show and talk about is that it's been incredibly bipartisan. It's not just groups like the Center for American Progress or our legal aid partners, Community Legal Services in Philadelphia, or even just, people who are impacted by the criminal justice system who think that this is a good idea. It's actually something that has had tremendous bipartisan support. Thinking back to the Pennsylvania law, we were just talking about the Clean Slate Act that's now helped about 1 million people in its first year since it took effect. The folks who came together to support that bill becoming law weren't just the political left and right. And it was a bipartisan kind of duo of folks who supported it in the legislature. In fact, one of the folks who was actually championing the bill from the state Senate was the same guy who was challenging the sitting governor, Tom Wolf, who's still the governor, for the governorship. This was what was happening when the campaign was underway. This was how consensus an idea this was. And I think it was because not only have we seen tremendous bipartisan support and momentum around the idea of criminal justice reform for the past several years, right. Lots of different pieces of that, obviously. This is just one piece. But we I think, also have seen an increased kind of awareness on the part of business business and employers in particular, and fiscal conservatives, that if what we're really trying to do is to shrink our bloated criminal justice system, and if we're also trying to make sure that people truly can have a shot at a second chance rather than being forced to kind of go, cycle back through the criminal justice system over and over because reentry is never really possible and never something that's on the table because you can't find a job and you can't find housing. And how the heck are you supposed to get your life back on track if you can't even have access to the basics? I think that kind of understanding has seeped through to include employers. The Chamber of Commerce in Pennsylvania was one of the lead champions of this bill before it became law, because they said, you know what, we don't think it makes sense for people to have this scarlet letter following them for the rest of their lives. And we happen to know that when you actually look at the research, you find that the best way to prevent recidivism is for someone to be able to get a job, and that people with criminal records make fantastic employees who actually are more likely to stay longer and have higher retention rates and higher performance. There's all of this, I think, growing understanding and awareness as this movement has moved forward, as the Ban the Box movement has taken hold, and as criminal justice reform has continued to be a bipartisan through line, that this is something allowing people to move on with their lives, allowing second chances to really be meaningfully accessible is something everyone truly wants to happen. And so I think it's really something people have all actually come together to agree on.
Yeah, I mean, I feel like you might be overstating all people or everybody, because it feels like there's still a lot of people that certainly believe in our prison system and incarceration and even in the drug war. But overwhelmingly, attitudes have changed drastically, I want to say, since the Clinton administration in the last 15 to 20 years, when Democrats were campaigning on tough on crime. And, where did that leave Republicans? They were certainly tougher on crime, if you will. But now it seems like there has been so much change in attitude and transformation. And I wonder, just to further the conversation, how the Black Lives Matter movement and the attention to it and the public opinion changes to it have changed attitudes even further when it comes to the incarceration and mass incarceration and the drug war. And as it all ties in with, as you're saying and keep making this point, economics. Everybody's a winner when you don't put people in prison for bullshit, and when you don't keep them there for bullshit, and when you let them come out and have their lives back.
No, I think you're summing up exactly right. I mean, to connect it to the ongoing and just incredibly important conversation that is the sort of next phase of what Black Lives Matter and the movement for Black lives for many years have been really kind of loudly and clearly communicating, but has now really become a nationwide and even international set of uprisings, forcing a national conversation that we have needed to be having for a long, long time about structural racism infusing pretty much all of our policy landscape, but especially our criminal justice system and law enforcement. I think that combined with the heightened interest in economic recovery because of COVID is actually a big part of why you're now seeing state lawmakers really rush to try to push forward these kinds of good ideas in droves. We were talking about Pennsylvania, which is this just immense good news in terms of the numbers coming out of that state, people helped who are now going to be in position to actually have a fair shot at jobs when the recovery starts to happen. But there's other states as well that have all been lining up. And we actually saw this tremendous groundswell of bills all passing state legislatures just last week. I feel like every 10 minutes I was seeing something new come through my inbox from state advocates that we work with. We saw Georgia passed a huge expungement expansion bill, a really, really big deal because almost no records were even eligible to be cleared in Georgia until that bill just became law last week. North Carolina passed a massive expungement expansion bill that also itself actually starts the process of creating an automatic process and using automation like Pennsylvania did. Folks are going to come back next year and do more of that. And then we also saw Pennsylvania itself do another thing last week just to sort of get ready to celebrate clean slate this week and that anniversary. They passed a major occupational licensing reform bill to say it's stupid to be hamstringing people who are skilled workers with qualifications from getting licenses in their fields just because of old criminal records that have nothing to do with how qualified they are to work in those jobs. Another really big win. All of this just last week. And I think it really is because of what you're describing, this sort of perfect storm of the conversations that we're now forcing up nationally, actually creating the momentum and the imperative for lawmakers to push forward these kinds of good ideas, which have already been either on the shelf or advancing in prior years, but are finally actually making it over the finish line and being prioritized because lawmakers can't afford to put them back on the shelf anymore. And they know they'll be held accountable if they don't.
Talking to the great Rebecca Vallas, she is in her aviary.
If that's what we're going to call it, because I didn't realize how loud the birds were, but you're going to make fun of me now.
I'm not even making fun of you. Like, whenever I interview someone and I hear nature, I don't think it's annoying. Like, I love it as a background. I don't know if anybody does find it annoying, let me know. But I love it. I just like to take a beat to listen to them. And it's just so great that we can, be outside doing interviews. All right. So let me ask you about another really important issue. As a result of this, a Clean Slate initiative, everybody has to check it out. In Florida, we saw a really important, was it a ballot initiative where they voted? Voters in Florida said, hey, listen, if you went to prison and you've gotten out, you paid your whatever debt to society, whatever bullshit people refer to it as, you get your right to vote back. Well, Florida Republicans didn't much like that. And they said, yeah, you can have your you can have your right to vote back, but we're going to throw in a monkey wrench in, which means you have to pay back retribution for whatever costs that you owe, meaning you're still not going to get the right to vote. What is the status of former felons in Florida and their right to vote? What is the fight like there, and how important is that issue right there? Just voting. You talked about the right to a job, to housing, healthcare, etc., but voting is super important too. What's up with Florida, and how does that expand to the rest of the country?
Yeah, no, it was hugely, hugely important what you're describing. The landmark campaign, people called it Amendment 4 in Florida. It was a successful ballot initiative that re-enfranchised 1.4 million people in Florida with felony conviction records who had lost the right to vote. This brings it back to them. And then once that success had happened and everyone was celebrating, really excited, the Florida legislature kind of reminded everyone that they existed and were full of a whole bunch of boneheads who decided to try and take that right to vote kind of back away from a lot of those people by saying, actually, you're only going to get your right to vote back if you've paid these Ferguson-style fines and fees that we as a country have been talking about the injustice of and the inanity of for many years now, since they came to light after Ferguson really kind of put a national spotlight on that as a criminal justice reform issue that had mostly flown under the radar. Thankfully,
which was funding police departments by giving fines to people in the community. It was just the craziest kind of vicious circle where people are being arrested and they're literally paying the police with fines for all kinds of bullshit things and that they can't afford.
Yeah, it's exactly right. And a lot of people have called it blood from a stone. It's these like little, fines and fees here and there that all kind of add up and that can actually cause people to end up owing thousands, tens of thousands, or in some cases, even hundreds of thousands of dollars to the courts in effectively a sleight of hand to where the courts are trying to balance their budgets on the backs of low income and largely Black and brown people because they figure they can kind of get get away with that rather than, have things like progressive tax systems that are fair and transparent and don't try to balance the budget on the backs of the people who can least afford it. That's very much the context here. So it was not just Ferguson. This happens in a whole bunch of places around the country. Philadelphia was one of them. Back when I was a legal aid lawyer, we were watching the city try to collect $1.5 billion from low-income, largely people of color in Philadelphia. But in Florida, we had this great news. 1.4 million people get the news that they're going to be able to vote. The legislature says, nah, fines and fees. And thankfully, the issue has now actually been litigated in the courts. And we have seen federal courts on multiple occasions now come back and say, you know what? To require people to pay these fines and fees that are legally questionable and that are certainly questionable as a matter of justice would be an illegal wealth barrier to voting. That's not something we allow in the Constitution, and they struck it down, and that is where things stand right now.
That's what I thought, but I'm glad that you reminded me and explained it to me. All right, so out of time, but next week hopefully I can catch up with you and we can talk about the pandemic and everything that has laid bare and how bad things were even before of this. There's always so much to talk about with you, but I know you have to get back to the birds.
Well, and I really appreciate you bringing up Amendment 4, because in our last 30 seconds that we probably don't have, I should, as the Clean Slate Initiative is getting a shout out, which I appreciate given the amazing work that they're doing. The new managing director of that initiative, who is stepping up to work with all these different state campaigns that are seeking to follow in Pennsylvania's footsteps, actually comes to the Clean Slate Initiative from the Amendment 4 campaign. It's Sheena Mead, who worked with Desmond Meade. They were some of the architects of that campaign. So your listeners may be familiar with her because she's a huge powerhouse, and she has taken the reins of this campaign and is already working with folks in states like Michigan, which also last week just cleared another Senate hurdle on their clean slate legislation. So she's already off to the races.
That's awesome. I want to talk to her. They see the success in states like Pennsylvania, and other states replicate this. This is true of many other public policies, including pernicious ones that we don't like. You see that it works or that it's effective for whatever means you want, and you say, let's try that. And that's huge and excellent news, and you are a big part of that. Rebecca Vallas, as always, thank you so much.
Always fun to talk with you, Pete, and just huge to be talking about this in the moment of COVID, given how much this is going to mean for folks with records who were facing Great Depression era levels of unemployment before there was a coronavirus. So huge that you wanted to cover this on your show.
Of course. So important. We'll talk again soon, hopefully next week.
That'd be great.
All right.
All right, absolutely. Listen to her podcast, Off Kilter with Rebecca Vallas, and follow her on Twitter at Rebecca Vallas. She is an anti-poverty hero, has taught me so much, one of the most intelligent human beings I've ever met, and one of the coolest, too. Love her. All right, so my final guest of today's show, again, is Eric Segall. He joined us yesterday to talk about the Supreme Court decisions that were announced yesterday, and today we've got new Supreme Court decisions on the separation of church and state, or more specifically, the Establishment Clause of the First Amendment, which the 5 conservative justices decided to take a shit all over. Here's my conversation with Eric Segall, which you can also watch on Twitter at his Twitter feed or mine, because we did this interview live on Twitter yesterday. I want to try to do more of that on Twitter and Facebook and YouTube and all of that. And here it is right now. Eric Segall at Eastman Segall, constitutional law professor at Georgia State University. Here he is. 3, 2, and we are live, everybody, live. It'll come up, Eric. Quit shaking your head. You'll see it. You'll see it. And then you see yourself? Now share it with your Twitter followers.
I just did.
Eric Segall. He is somewhere on vacation, and I'm so happy he's joining me to talk about the big Supreme Court decision that came down today. I left my natural lighting on to seem like I'm on vacation, but you, in fact, are on vacation. I appreciate you joining me to talk about this very, very important case that dropped today. Thank you, sir.
My pleasure. I would not disturb my vacation, but for a few people in the world, and you are one of those few.
Oh, who are the others?
No comment.
Okay. So, Hannity?
No.
Today, the Supreme Court dropped a ruling, 5-4. Conservatives, including Justice Roberts, against the 4 liberals. It's a religion case. It's about schools and funding, and I want to know why it matters, how important it is, what it means, but more important, Segall, what's the history of this fight? Schools, religious funding.
Yeah, it's a really, really important case. Justice Roberts wrote the opinion, 5-4, conservatives, liberal, and it's no coincidence, in my opinion, that this case came the day after the abortion decision yesterday. I think Roberts timed that for a very specific purpose. Montana used to do what a lot of states do. They fund public schools, all states fund public schools, and then they take some money out for private schools. And some states help out private schools financially and limit it to just non-religious private schools. Other states include private religious schools in the distribution of books and computers and money. There was a time when the big issue was, could states give money and computers and chalk and erasers to private religious schools without violating the Establishment Clause of the First Amendment, which says the government can't establish a religion. I litigated those cases at the Department of Justice, and the issue was, could they do it? Today's case is a sea change. Today's case is not can they do it, they have to do it. They have to do it. The court interpreted the Free Exercise Clause of the First Amendment to say that you can't discriminate against religious schools when you're handing out government benefits. And it is an abysmal decision. And Pete, what's most important about it is what's coming next.
Oh, no. What's coming next? The Taliban?
Yeah. So you've heard of ALEC, I assume?
Yeah, the American Legislative Exchange Council. It's this right-wing group that writes laws and lobbies at generally starting at the state government level, lets them experiment at the state level, and then pitches them also to the federal government. They're kind of a shadowy group, but everybody knows about them.
All those things. Now, they were not directly involved in this case, but what they are directly involved in is trying to destroy public school education. They just are. Trying to
destroy public school education. Today's case, won by conservatives at the Supreme Court. What's it called? Espinoza
versus the Montana Department of Revenue. Yeah.
What it does, today's case, is it takes a giant step towards the destruction of public.
Let me slow down a little bit.
Too hyperbolic?
Maybe too hyperbolic, but not by a lot. So
how would you phrase it?
The next case is going to be this. If I send a kid to private religious school, but I have to pay property taxes to fund a public school in my neighborhood, then that's discrimination. And the public school must spend money, public school district must spend money on my private religious school, just like it spends money on public schools. Otherwise, you're discriminating against religion. Now, that sounds far-fetched because of the way our country has run for 150 years. But this opinion today is one giant step forward towards that. Let's back up.
Hold on a second. Does this, I want to gripe. This sounds like a very kind of right-wingy, conservative, complaining thing to say, but I'm going to say it. Well, but it's a liberal thing to say. I don't want my taxpayer money going to a yeshiva or a Catholic school or a Muslim school. I don't want my money going to schools that teach religion because I don't like that religion. I want my money to go to public science and math, and they don't have a religious bent to them, not all that stuff. How's that sound?
That sounds perfect. And how do you feel about in many states, Pete, there are private schools that are rich and uniforms and for the hoity-toity.
Yes, I've worked at them. I coached lacrosse at one of the most prestigious private schools in Manhattan. Call it the Trinity School. Go ahead, use it as an example.
No.
Okay.
There are thousands of other private schools that aren't like that, that do really good work, that take poor kids off the street and try to educate them and so on. If a state wants to help those private schools out, but doesn't want to help out Catholic schools or Orthodox Jewish schools, before today they could. And that, when I say before today, I mean from the late 19th century until today. Today, the Supreme Court reverses all of that and says you can't do that anymore.
Religious schools are private schools. For this everybody needs. Sometimes we don't categorize them.
a Catholic school, which to me is the most common religious school. Is that right?
Yes,
everywhere in the country?
And it is. Empirically, it is in the country.
All right, certainly was where I was growing up. That is a private school. Then there are secular private schools that aren't necessarily hoity-toity, although I don't know which ones you're talking about, unless you're talking about some kind of weird charter schools. But nonetheless...
Well, hold on, stop, pause. Charter schools is a big deal here. It's unclear what secular charter schools' future is after this case. If the public school district is going to open up a special charter school and run it in a secular way, which is what it's going to do, obviously, then the next argument is going to be by taking religion out of that charter school, you're discriminating against religion, and you have to give the same money to Catholic schools and Jewish schools and Muslim schools. And that's a revolutionary thing if that happens. But go back to today's case in Montana, Pete. To me, this forget all the legal jargon, forget like establishment clause rules and free exercise clause rules. Policymakers want to help kids in private schools get a better education because then all our kids are better educated. And before today, they could do that without subsidized Bible study in Catholic school. Now they can't. And that choice, what you said earlier beautifully, you don't want your tax dollars going to religion, period.
I don't want my tax dollars going to teach kids crazy religious shit. I don't want my tax dollars going to teach my neighbor's kids or anybody else's kids that there's a place called hell that you go to if you punish, because that's fucking insane. No, I don't want my money going to that. I want my money. There's things. Listen, I wish I could come up with curriculum. I'd teach conflict resolution. I would teach mindfulness. I teach all kinds of things, but it would all be science based. I would teach literature, all kinds of things. But in lieu of that, we have a public education system right now that teaches math and science and art and music. That's got to be the best case scenario in America right now.
Well, I mean, it's just incredible to me, and I've mentioned this publicly in several
other countries, civilized, progressive-minded countries don't do this. Canada doesn't do this.
Well, Canada does do this because they have to have religious public schools.
Idiots.
But forget Canada.
God damn Canadians.
Pete, when I worked at the Department of Justice, my client was the Department of Education, and there was a federal program that provided billions of dollars to private non-religious schools and private religious schools. Americans United for Separation of Church and State. Think of that name. Americans United for Separation of Church and State brought a lawsuit. And I worked with...
Great organization.
Yeah, it's a great organization. And but I was defending this program because I was a lawyer. I didn't like the program, but I didn't think it was unconstitutional, so I defended it. And I worked really closely with a highfalutin lawyer from a law firm called Williams and Connolly in D.C.
I know them.
Prestigious law firm.
Yeah.
And he was the lawyer for the United States Catholic Conference. The United States Catholic Conference had a huge vested stake in making sure the government could give money to religious schools if it wanted to. But not even the U.S. Catholic Conference thought for 1 second that the issue would ever be they have to give the money. The issue was, could they give the money? But the idea that they have to do it.
That's what this decision.
Yes. And it's insane. And it's really bad. And here's some other things.
I didn't even read the opinions on it. Is there anything you want to tell us about the conservative opinion argument that they made?
It has virtually no originalist basis, yet Gorsuch and Thomas joined. Oh, yeah, Justice Thomas. He reiterated his long-standing view today that the Establishment Clause should not apply to the states at all.
What?
Pete, what that means is if Georgia wanted to declare an official state religion, it could do so as long as it doesn't coerce people. Thomas agrees you can't put someone in prison for not being Catholic, or you can't punish people for their religion. But he has zero regard for the Establishment Clause, so much so that he thinks Georgia could say, we're a Protestant state and we're proud of it, which 99.9% of law professors would say they could not do. Liberal. Thomas said that today. The four liberals were very upset, and rightfully so, for a lot of reasons. I don't want to go into this, but Sotomayor's dissent pointed out that the court should never decide this. There were technical reasons why this was an unnecessary decision. I wrote about that on Dorf on Law. I sent you the link earlier. I wrote about that on Dorf on Law. And it's true. This case should never have been decided, period, leaving aside what they decided. But this is what these 5 conservatives want. They want a theocracy in some serious ways. It's sad. Judge Posner and I once wrote a New York Times op-ed about Scalia, saying he wanted a majoritarian theocracy. And we got in trouble for that, but it was true. And so did these justices.
That's crazy to say. We almost made it through an interview without you saying Posner.
And that's what we're going to have.
All right, I'll let you get back to your vacation, but I do have to, give you some grief because it would seem, this used to happen to me when I was on the air all the time, and people kind of knew when you're a public person the way you are on social media. Now you get your own podcast and you're doing interviews with all these people. People follow you. They see it. You're on vacation. You make no secret of what's going on. And they know you're on vacation. We know you're on vacation for the second time in, I think, 2 weeks.
No, 4 weeks. 3 weeks. 3 weeks.
You were just on vacation.
I want to explain.
This is like the guest house of vacations.
And I want to explain. In late May, middle May, I decided we had to get out of quarantine, and Hilton Head was opening up, and so I rented a house for the first week of June. One day later, close friends lent us their house in a different island on this coast for free for 9 days. I wanted to cancel this trip, but it was non-refundable. So the woman was very nice and let us move it 3 weeks later. But this trip would never have happened had I known about the other trip, which was not free.
Well, that's an interesting explanation. The generosity of friends loaning you their place.
Yes.
But you didn't want to obviously lose this other vacation that you'd paid for. So
See? By the way, the other thing is Mike Dorf gave me enormous shit yesterday.
Yeah, for your privilege?
For being involved in these things on my vacation. And
to be doing interviews. Well, it's June. It's the time when you're in most demand, and it also happens to be summer. I get it, but you know what?
My amazing wife knows that sometimes we have to vacation in late June, and when that happens, I'm going to be doing this because this is when the Supreme Court does all of it.
And I absolutely agree with Dorf and anybody else. I'm actually struggling with that right now because I'm going away on Thursday. Val and I are, and we're in the girls, and I want to not work. But I'm having a really hard time understanding how I could possibly do that. I want to post podcasts every day. I don't want to not work. So maybe I'll do it ahead of time. But I really have to not work and shut it down. And I'm struggling with that.
You should do maybe halfway. I mean, for me,
a hybrid.
Once the term ends, I'm done. So I have an end point. You don't have an end point.
Right.
But I would go mostly on vacation and do an hour a day.
That's Eric Segall. Thank you for the advice. Thank you for joining me on your vacation. There are people watching that want to know about the hat. Is there any story about the hat? Is there anything we need to know?
This hat was purchased to go to South Africa last year. But wait, this is a COVID hat because baseball hats that I usually wear, you've seen me in baseball hats, no longer fit on my head because of my hair.
Yeah, and I see the hair coming down behind your ears, and I like it a lot. I think it's great. On your first episode of your podcast.
The beard?
I like that too. It all looks good. Good. You look great. You look relaxed.
Thank you.
And
so you're going to be on vacation when the court decides not to release Trump's tax returns.
I'll come out of vacation for that if you'll talk to me.
Okay. Yeah, I will. Anytime. Buddy.
Thank you, pal.
All right. Thank you.
Bye. Thank you, Eric Segall, for joining me again and from your second vacation within 3 weeks at Eastman Segall on Twitter. Please tell him you heard him and all of my guests, that you heard them on the show. That always makes a big difference. Let them know. There's not really a lot of metrics for people that come on podcasts to know whether or not it makes a difference. But I always love that they'll join me in conversation, and I always love when you thank them for joining me in conversation. If you haven't given this podcast a rating and 5 stars, then maybe think about doing that today. That stuff matters. And if you're not a paid subscriber, I would love you to become one. Go to the paid subscription link in the show notes, or just go to patreon.com/PeteDominic.
This show is executive produced by Pete Dominic. The show is edited by Pete Dominic. The show is booked and hosted by Pete Dominic. Other shows are once or twice a week with a team of producers. This show is daily, and it's just me with your support. I'm not complaining. I'm not bragging. I'm just telling you I can't do it without you. So please consider a subscription, and that is the end of my ask. Thank you. And the end of today's show, episode 138. Thank you for listening. Know that you're not alone. Know that I am here and so many others are on this journey along with you, and I care about you. I'd love to hear from you. I'd love to talk to you. I'd love to learn more about you. So reach out anytime. My email, as always, is standupwithpete@gmail.com. You can DM me on Twitter and like the Facebook page, Stand Up with Pete Dominic. If you haven't already, like that Facebook page, Stand Up with Pete Dominic, because I've got to get that more active and be posting a lot more there, as well as my own personal page, which has maxed out. So like that one, and also on Instagram. And that's it. Thank you all. Talk to you tomorrow.